All right, guys, welcome to the Heart Health webinar. Uh, heart disease is the number one disease killer in men and women. Right now, the stats are about 1 out of 4. So, this workshop specifically is for, kind of two real types of people right now. One of them is the fact that, like, you've already been going down that path. You have diagnosis that's indicating heart disease, and you're looking for better, healthier solutions than just more and more drugs. And the other type is the person who doesn't have any heart disease symptoms at all. And you might think that you don't or will not get heart disease, but that's not the reality. The reality is it's a 1 out of 4 chance. So right now, 1 out of 4 people watching this right now will die from heart disease. And my hope and my prayer for you guys is that that's not going to be you. That's why we're doing this event. That's why we're doing this heart health webinar, to really focus on understanding the underlying causes of heart disease, but most importantly, what we can do to empower ourselves to live healthy, to create a healthy heart, and to not end up with sickness and disease and on tons of medications and just ultimately feeling terrible. So let's jump right into this. Guys, I'm Dr. Brent DeLong. If you're not a patient in the office and you got sent this webinar, I am a max living chiropractor in Norman, Oklahoma. I've been in practice for over a decade and working with tens of thousands of patients. And ultimately, what I've seen over the last decade is the difference between treating disease and creating health. And my ultimate goal is to help you guys understand how to live through the Max Living 5 Essentials to create vitality and to either prevent disease or overcome it. Because the reality is your body's created to heal. Your body's created to heal. We just have to remove the damages and the cause of the disease, not just cover it up with drugs and surgery. And ultimately, our goal with Max Living is to really create the standard for natural healthcare and empower people to live to their truest health and God-given potential. But like I said, heart disease is the number one disease killer, more than car accidents, more than cancer. Right now, every 37 seconds, someone dies from heart disease. That is a staggering statistic. And again, my hope and prayer is that you can understand how to not be one of those statistics. But your heart is incredible. When you think about like what your heart actually does, it beats over 100,000 times every single day, and it pumps 2,000 of gallons of blood every single day to every corner of your entire body. So it carries blood which carries nutrients and oxygen to every cell, tissue, and organ in your entire body. So for any part of your cell to live, they need nutrients and oxygen, and your heart is responsible for pumping that blood, pushing that blood through every blood vessel to every cell, tissue, organ in the entire body. So it's a pretty amazing organ, even though it's only really the size of your fist. And when we talk about those scary statistics, it's 1 out of 4. What it looks like, and if it's following its current trend, if people don't really understand how to take control of their health, these numbers are really only going to get worse. It's said to even increase to about 1 out of 2 people in the next 10-15 years. In fact, if it follows its current trend, by 2030, the cost of heart disease is going to triple. It's going to go from almost $300 billion to almost $800 billion annually, every single year. It's going to potentially bankrupt our healthcare system, because people are getting sicker and sicker. And again, this is what we don't want to happen to you. Now, one of the reasons it's so important for you to start paying attention to this stuff and really start to move out of what the current system is doing is because they did a study and they looked at autopsies of kids that had passed away in accidents, and they looked at heart health. And what they found is 20% of kids as young as 5 years old already had plaquing starting in their arteries. So heart disease was starting in kids as young as 5 years old. But it's our responsibility to raise up a healthier generation than its current what is current looking like. In fact, right now is the first time in human history where it's said that our children, that generation, is said to have a shorter life expectancy than us. So again, we have to learn how to take responsibility for our health so that we can teach our kids so that they don't end up, again, with these crazy statistics with heart disease, cancers, and diabetes. Well, but it always wasn't like this. Heart disease wasn't always as bad as it is now. In fact, it wasn't until about the 1960s where heart disease started to explode on the scene and started becoming kind of what the statistics are today. Well, what changed? Well, ultimately, it was lifestyle stressors. Right around the 1960s, 70s, that's when diets really started to shift. That's when you started to see a lot more of the no-fat, low-fat fad. If you ask people how stress was back then compared to now, people were excessively stressed more now than they were 20, 30, 40 years ago. And even the amount of toxins that we're exposed to are significantly different than they were back in the 1960s, 70s, 80s. But it wasn't a lack of medication. You know, it wasn't a lack of lisinopril and Crestor and all these different drugs. It wasn't a lack of medication that caused these heart disease stats to explode. It was literally lifestyle stressors. So in the medical system, and this is one thing that we're going to really talk about today, is the difference in the medical system approach, utilizing drugs for treatments, and ultimately finding root causes and changing those causes to allow the body to get healthy. But this is like a pivotal point to understand is it was not a lack of medication that caused heart disease to explode. In fact, we in the US take more heart disease medications, blood pressure, statins, cholesterol drugs. I mean, all this, we take way more drugs than any other country in the entire world. Yet we have higher statistics, higher rates of heart disease, cancers than any other country out there. And so, yes, while a medication might save our life in a crisis, I've never met a single person that really truly believed that more drugs equals more health. More drugs don't equal more health. In fact, drugs are just covering up the underlying cause, and the cause is typically worse. And that's why people tend to get sicker when they take drugs, not just the side effects, but the underlying causes consistently get worse. Now, when you look at, and this is kind of a shift in paradigm, and we'll talk about lifestyle stuff and help you understand how to change lifestyles, and you probably know a lot of that already. But this is an important shift in understanding the stressors causing dysfunction in the body. And it's your nerve system that helps your body adapt to that stress. The more stressors, the more demand on your nerve system for that adaptation. And here's just an easy example, but when you walk outside and it's real cold, that's a physical stress on the body, and your body starts to shiver to create warmth. That's your nerve system. That's your nerve system sensing the stresses. That's your nerve system activating that process of shivering to create extra warmth. But the more stress, the more demand on your nerve system, and eventually your body has a breaking point where it can't handle the stress, and that's what allows the disease to build. In fact, when you think of, or here's kind of an interesting, like, again, paradigm shift. Like when you look at like the cause of disease, like the cause of heart disease, there was this medical doctor, Dr. Thomas Cohen, and he's renowned for talking about this. Most heart disease, like most heart attacks, are likely caused by an imbalance in your central nerve system, your CNS, in your autonomic nerve system, which controls function of your internal organs. Your nerve system is what controls your body's ability to adapt. When you go in for like a heart checkup, or they do a heart test, like a stress test, what the medical system is doing is they're putting your body under stress so they can see how your heart adapts. That really lets them know like how healthy your heart is. But it's your nerve system that controls your body's ability to adapt to that stress. And that's exactly what Dr. Cohen is really talking about. It's your nerve system's control, your nerve system's influence and ability to self-regulate that stress that ultimately is what determines health or not, your heart health or your heart disease. And it's the balance. Ultimately, you're really thinking about the balance of your parasympathetic and your sympathetic nerve system. This is like your sympathetic is like the fight or flight. That is the nerve system that it's the adrenaline. It's what allows your body to like handle like stress in the moment. If you're getting chased by a bear, your body's not worried about your immune system. Your body is worried about getting away from the bear. And so all the blood flows to your muscles, your adrenaline goes up, your cortisol levels go up, so you can escape that initial stressor. But ultimately, when the stress is gone, your body should self-regulate. That balance in your nerve system should kick in, and your parasympathetic nerve system should start to take over. And that's the nerve system that ultimately is what's in control of things like digestion. So you're breaking down nutrients and turning them into eyeball cells, you're turning them into muscle tissue, you're turning them into heart cells. But when you're in the moment of stress, when you're running from the bear, your body's not really concerned with that. It's not concerned with digesting food. It's not concerned with rebuilding cells. It's not focused on your immune system. But in that sympathetic state, that's what your body is really focused on. It's the repair mode. It's the healing mode. That's your immune system kicking in, fighting off bad cells, cancer cells. It's your heart, it's your muscles, it's the rebuilding phase. That's the balance that creates health. When that starts to get imbalanced, that's when you start to get dysregulation, dysfunction. So your stress test is going to look real bad, and ultimately that's what's going to lead down the pathway to disease. And again, your nerve system's in control of every single cell, tissue, organ in your entire body. So for your heart to beat, lungs to breathe, digest food, for your immune system to function and fight off viruses or cancer cells, for a cut to heal on your arm, or for your body to self-regulate blood pressure or self-regulate inflammation, that nerve system has to communicate at 100%. 100%. That communication is vital. And we know that because if someone had a really bad injury and say it like severed or cut like all the nerves that go to the heart, like if they cut all the nerves that go to the heart, I don't care how healthy that person is or how healthy the heart is. If you cut the nerve, there's literally no life input to that heart. The heart stops functioning. So instantly the heart would die. That's how we know the nerve system is so important in controlling health and overall function. And I want to share two stories with you guys here real quick. Heart disease has really specifically affected me personally. When I was younger, somewhere around teenage years, early teens, I remember my dad starting to get real bad chest pains. And a lot of times it was real scary because it looked like he would be having a heart attack. And early on, before they had the diagnosis, that's what we all thought was happening. We thought my dad was experiencing like these heart attacks. And too often, like tough guys do, we tend to ignore symptoms, especially if like the initial symptom goes away. And it took several episodes of what looked like my dad having a heart attack for like my mom to catch on and to like drag his butt into the hospital to finally get this diagnosis. And he was diagnosed with something called hypertrophic cardiomyopathy. And basically it's heart muscle dysfunction, and the heart muscles get too thick and they get rigid and not a lot of blood flow goes there. And so it affects the body's ability to pump blood to the heart to pump blood to the body. And in extreme examples, this will cause the heart to basically just shut off. And so it's a really dangerous diagnosis. And so when my dad got diagnosed with this, obviously like the medical doctor's approach was to start putting him on all these different medications. And what comes with every single medication is a side effect. So my dad started getting all these different side effects from these different medications, and ultimately it didn't really help his health. In fact, over the course of 10 years, I watched his health decline. The man I admired most in this world, I had to watch his health decline over 10 years. And so eventually the doctors decided that the medications weren't working and that they had to do something more aggressive. And they decided to do something called an ablation. Now I want you to imagine this. Imagine my dad sitting in that hospital room and the doctor says, hey, the drugs aren't working. Your heart's shutting down. We're going to have to do an ablation. And you're like, oh my gosh, what the heck is an ablation? What is that? Well, basically they took a syringe of alcohol and they injected that into part of his heart, his left ventricle specifically. And what it was designed to do was to kill off part of the tissue. Now, if any part of your heart dies, that is called a heart attack. So the solution that the medical doctors wanted to give my dad was to give him a heart attack. That's what the doctors, that's what the medical system was going to do. Drugs didn't work, weren't working, health was getting worse, heart was shutting down. Okay, well, let's go in there and let's kill part of this heart. That's what the medical doctors wanted to do. Now, I didn't know this at the time, but once I got into chiropractic school and going through all these different medical courses and starting to learn about the nerve system and the anatomy, this is some of the dots that I connected. Okay, so follow me. 10 years before my dad got that initial diagnosis of hypertrophic cardiomyopathy, he was running a bull through a chute, right? Big bull. And he ran this bull through a chute and it pinned him against the wall, and he ended up breaking his third and fourth rib. The third and fourth rib attached to the third and fourth vertebrae right here in this upper part of the back. And that area of the spine, that nerve system, is what controls or protects the nerves that innervate and control function of the heart. That damage caused a misalignment. It caused a subluxation. And that subluxation stressed the nerve going to my dad's heart. And that subluxation was left there uncorrected for 10 years to a point where it created enough dysfunction in my dad's heart to create these symptoms and then finally be diagnosed with this heart disease. Now, one of the interesting things is my dad never had back pain. His upper back never hurt. He never went to the chiropractor because his back hurt. Now, fast forward and I'm in practice. I take an x-ray of my dad's spine. He has a big curvature in the upper part of his back. There's a misalignment caused from that initial injury that was never corrected. And now you can literally see on his x-ray this big curvature right where the nerves go to the heart. There's no medication in the world that's going to adjust that spine, get pressure off the nerve system so the body can start to heal and regulate. So here's the second part of this story. So in practice, I was in practice for a couple of years early on, and I had this young kid come in. He was 16 years old, diagnosed with hypertrophic cardiomyopathy, the same thing my dad had been diagnosed with. And when you have a diagnosis like this, there's a couple parameters. One of them is that you can't exercise or be physically active because the heart is a muscle, and when you exercise, your heart gets stronger. It's a muscle. And so what the doctors told this young kid is that you can't be physically active, you can't work out, you can't play sports. I mean, can you imagine being 16 and not being able to do any of that? That blows my mind. But that's what the doctor told him, and they told him that you're going to have to take these drugs for the rest of your life. And so they put him on a bunch of medications. Now, when you have this diagnosis, you have to go get these scans done every 4 months to see how big your heart is growing, how aggressive this is, so they can determine how aggressive to get with treatment. And so when he had gone to the doctor, his atrial septum had grown to 7 millimeters. So it was 7 millimeters thick, which is way too thick. And so it was progressively getting worse. And so he came into the office, and I took an x-ray, and there was a big curvature in the upper part of his back, misalignments, subluxations, putting stress and damage on the nerves going to his heart. And so we started to adjust him. We're starting to adjust the upper part of his spine. We're trying to get pressure off that nerve system. So we consistently adjust him, and we adjust him for 4 months. He goes back for a routine checkup. And in 4 months, his atrial septum had shrank 4 millimeters. His atrial septum was healing. The disease processes was healing. Now, this is important to understand. I'm not treating heart disease. Chiropractors, we do not treat disease. All we're doing is adjusting the spine to get pressure off the nerve system to allow that communication so we get better function. The nerve system is in what's controlling all the cells, tissues, and organs. And so the better the communication, the better self-regulation, the better adaptation. So literally, as we were correcting his spine, his body was able to start to heal. That is ultimately what chiropractic we're trying to accomplish, is help the body to self-regulate. We're trying to improve the nerve system's control over the body. And I share that story because no one ever told my dad that. No one ever told my dad, hey, you should go to the chiropractor for your heart health. And so he was led down the path of medications. So we're going to talk about nutrition and supplements, and we're going to talk about some really good stuff to help support cardiovascular and heart health, but understand it's your nervous system that really ultimately is what is in control of your body's ability to self-regulate, to regenerate, and to heal. In fact, there's numerous chiropractic studies on heart health. In fact, some of these are even from, I don't know if you've ever heard of the cardiopaleologist. He's one of the most renowned cardiologists in the country. And he's a big fan of chiropractic because he's seen the research. So even by adjusting the upper part of the neck, your atlas, your C1, in medical literature, it's been proven to lower blood pressure 17 points on average. Chiropractic improves lung function, which obviously is improved blood flow and oxygenation. It also improves autonomic function, which is your ANS, your central nervous system, the balance between your sympathetic and your parasympathetic nervous system. It increases heart rate variability, so your heart's ability to adapt to stress. And it's even been shown to lower inflammation. Those are just some of the main chiropractic studies on heart health and cardiovascular health. But ultimately, what we're going to talk about in improving overall health to minimize negative effects of things like heart disease, we're going to walk you through all 5 essentials. Every single health category under the sun falls under one of these max living 5 essentials. And essential number 1 is the nerve system, spinal integrity, neural integrity, neurophysiology. And that's what we just kind of covered in the beginning part. So let's jump into the other essentials. I want to talk about heart attacks. And then again, go through the 5 essentials and what we want to do. But heart attacks really caused by a couple things. One of them is coronary artery disease. And what happens when your body becomes systemically inflamed, you start to build plaquing, and plaquing in those arteries start to clog blood flow or shunt blood flow. So it stops blood flow going into specific areas of the body, muscle cells, tissue cells. And if you have a blockage of a coronary artery, which is the arteries that feed blood to the actual heart muscle, that is one of the main causes of heart attacks. If the heart muscle is not getting nutrients and oxygen, it's going to shut off. It's going to die. And again, that's the heart attack. Blocked arteries in the heart muscle obviously cause a lack of oxygen to the tissue, so tissue cell death. So again, that's what leads to things like heart attack. Now, ultimately, when we look at underlying causes of inflammation, so inflammation is what leads to the clogging of the artery. Looking at what causes inflammation, one of the major causes of inflammation is systemic chronic high levels of insulin. Chronic levels of high blood sugar, chronic levels of high levels of insulin, that's what leads to chronic inflammation, damage in arteries. It leads to sclerosis. So when the plaquing becomes sclerotic, it becomes hardened, and that's when the arteries are really rigid. And again, it blocks blood flow. That causes the deficiency in oxygen to the tissue cells of the heart. Boom, that's what leads to the heart attack. One of the other things about inflammation is it decreases a lot of nutrients absorption. And so we're going to talk about that. But I want you to understand ultimately what cholesterol is. Cholesterol gets such a bad name, and we think that cholesterol is what causes the plaquing of the artery, but it's not really how it works. So cholesterol technically is proteins that carry lipids to and from areas of injury. So most of the cholesterol is actually created by the liver. And the liver produces these cholesterols as basically band-aids. It's going there to try to patch up inflammation and damage. So high levels of LDL mean that you have a lot of inflammation and your body's trying to put a bunch of band-aids over the damage. That's why you don't want to see like high LDLs on a blood. That's also why it's known as like bad cholesterol, because it means you have a high level of inflammation. HDL is the body carrying the cholesterol from the injury site back to the liver to get basically recycled. So you want really good HDL levels, because that means your body is pulling that from the inflammation, hopefully meaning the inflammation is healing and you're not needing as much of that cholesterol at the injury site or at the areas of inflammation. But again, high levels of LDL mean that there's a lot of inflammation, and you don't really want that, because over time, if you don't remove that underlying cause of inflammation, so if it's chronic elevated inflammation and the body's consistently throwing cholesterol at that, eventually that gets oxidized, and that can lead to the plaquing, and that leads to stuff like the heart attack. But cholesterol necessarily isn't the bad guy. The cholesterol is the band-aid. The underlying problem is the inflammation. In fact, here's a study that really even shows that the LDL does not cause cardiovascular disease. In fact, one of the interesting studies that they show is that more people have heart attacks with good cholesterol from a statin, like if you're on a statin and your numbers are good, there's more evidence of people having heart attacks in that situation than if you weren't taking a statin and you just had elevated cholesterol in general. Because of the underlying inflammation and the damage to the arteries, the statin drug isn't fixing that. It's just tricking your body into not producing the cholesterol. So the underlying inflammation and damage is still there, leading to, again, more and more heart disease. Now, this is something that we've really got to understand. The body is either smart or stupid. It can't be both. Your body is either smart or stupid. It can't be both. I think there's way too much evidence to understand how intelligent the body is. In fact, there's like trillions of chemical reactions occurring all of the time that our body has to have for metabolic processes and for us to live. I mean, trillions and trillions of chemical reactions. Everything the body does is intelligent. Every response is intelligent. Again, you go outside, it's cold, your body shivers, it's trying to create warmth. That's an intelligent design. If you have inflammation, if there's damage, your body will increase cholesterol to try to help heal that area of damage. If your body is under stress, your blood pressure will go up so that you can get blood flow to your muscles or wherever it needs to go so that you can heal and function. Understanding that your body is intelligent really changes how you look at treating symptoms. If you believe that the body response is intelligent, then why would you give a drug to stop the response? If you believe that your body is doing something correctly, then why would you give a drug to counteract that response? It's almost like a fever. We all know that fevers are good. They're your body responding to an immune response. Your body is so intelligent that it'll increase the temperature to kill off viruses and bacteria as a defense mechanism. Like, that's how incredibly intelligent your body is it increases the internal temperature to kill off the invaders so that you don't get overcome and die from the invaders. Like, that's how. So you wouldn't want to take a fever reducing medication because you're hindering your immune system. Now, obviously, the conversation or the debate could be into like crisis situations. Like if your fever like skyrockets way too high, that it could be dangerous. Now, the real research doesn't really support that. Technically, like high fevers of 105, things like that, like really aren't that damaging. In fact, your body has a defense mechanism where your body will probably create a febrile seizure to stop it from going up. And once you have a febrile seizure, you'll break your fever. So your body has like defense mechanisms. It's almost like a breaker switch. So again, our body is really, really intelligent. Now, of course, if there's a lot of dysfunction and a lot of disease, it could create a crisis situation where you might need a medical intervention. That's not what I'm talking about. I absolutely think that there's a time and place for medications. Like if your blood pressure is like skyrocketed and you haven't really been able to focus on the underlying causes, but like you're about to like borderline have a stroke because your blood pressure is so high, yeah, you probably need a medication to lower that blood pressure so you don't like stroke out. But you don't want to just continue to take that drug. You want to look at what was causing that blood pressure to skyrocket. What was the underlying reason that the body was doing that? If you can look for what the response is, why is the body intelligently responding to that? It changes your entire approach to health. It changes your entire approach to health and how you treat the health of your body. But let's talk about like the actual reasons for high cholesterol. Why would your cholesterol be high? Why would it be a defense mechanism? Well, a poor diet, saturated fats, trans fats, lots of sugar, all those things cause severe inflammation. And so your body in a defense physiology, as it's trying to heal that damage that you're doing, increases cholesterol. The problem is you don't change that and you consistently have a poor nutrition plan with too much bad oils, bad fats, too much sugars, processed foods. So the inflammation consistently is there or consistently gets worse. And so that's why the cholesterol continues to climb and it never actually gets any better. A lack of exercise. So sedentary lifestyle increases cholesterol. Being overweight, higher rates of cholesterol. Again, your body is not meant to have that extra weight, that extra damage. And so you're going to see higher levels of cholesterol. And obviously, as we get older, they've seen higher levels of cholesterol because, again, there's more stresses or there's more damage accumulation. So a lot of times you'll see higher levels of cholesterol just as we get older, even just as a normal process. Now, here's some other causes, and you can see this, but it's type 2 diabetes, high levels of stress. So just emotional stress will increase cholesterol, because emotional stress, again, stresses your nerve system, and that causes inflammation. And then again, your body has this defense mechanism to create high cholesterol, so that way your body can try to heal. Hypothyroidism, kidney disease, liver disease, even a lot of medications will increase cholesterol. Polycystic ovarian syndrome, like all these things will create higher levels of cholesterol. On that, this is important to understand too, as far as defense physiology and how intelligent the body is. If you have an injury, the body's going to naturally increase cholesterol. So my wife is pregnant. We were due in August with twins. After the birth process, which is relatively traumatic on the mother, you'll see higher levels of cholesterol, because the body's trying to repair all the stress and all the damage that the body just went through. If you have an injury like a pulled or a strained muscle, or a torn ligament, or some sort of injury, you'll see higher levels of cholesterol, because again, the body's trying to repair that. The body's trying to repair that. So to take a cholesterol lowering drug when your body's trying to repair, it just doesn't make any sense. Now, obviously, we have to watch those numbers, because if you have chronically elevated cholesterol levels, again, it's a warning sign that there's dysfunction, and that can lead to disease. But you don't want to treat the number or the cholesterol. You want to really help to identify the underlying causes and correct that, so your body has a normal, healthy response. This is a fundamental, paradigm shift. But healthy bodies don't have chronic elevated levels of cholesterol. Healthy bodies don't have heart disease. Healthy bodies don't build cancers. Healthy bodies don't have diabetes. So instead of focusing on treating the disease, which is the fundamental philosophy approach in the medical model, is to treat disease, in a chiropractic approach, our job is to try to build the body healthy. Medicine is the study of disease, in which what causes man to die. Chiropractic is the study of health, and what causes man to live. We are looking at this through a chiropractic paradigm, where we're trying to remove interference and allow the body to go back to its normal state, which is healthy physiology, adaptive physiology, homeostasis, homodynamic. Now, other causes of high cholesterol are toxins, and this is one of the 5 essentials, is understanding where toxins are coming from and how to minimize those toxins, and even how to make sure that we're getting toxins out of the system through specific detoxification channels. So there's a lot more toxins just to this, and we'll probably put on maybe in some of the links or some follow-up information on some of the major sources of toxicity. In fact, we did a webinar not too long ago about toxicity in our environment, where the major sources are coming from, and how to avoid those, where to start, how to do it, because it's a deep rabbit hole. But ultimately, it's one of the most important, because toxicity is so damaging on our body and our health and our physiology that it leads to disease. And I think everybody understands that. It's identifying the major sources, removing them out of our environment, and those that we can't remove out of our environment, we have to focus on getting healthy and aiding our body's natural detoxification processes, so we don't get the accumulation of those toxins, which will lead to elevated cholesterol levels and eventually stuff like heart disease or heart attack. So here's some really good cholesterol supporting nutrients. Plant sterols, these are really cool, because they actually mimic cholesterol they block cholesterol absorption. And so when you have maybe elevated levels of stress or elevated levels of inflammation, it really helps to reduce that inflammation by blocking some of the cholesterol absorption. So it's really helping to lower, it's a really natural way to help lower cholesterol levels, which again, it's not necessarily getting to the root cause, and it is treating the cholesterol, but it's not a toxic, it's better than a medication, because it's natural. Curcumin, this is ultimately one of my favorites, because it is one of the most powerful anti-inflammatory and antioxidants out there. This is something that I take on a consistent basis. I recommend to every single one of my patients, because again, we're all bombarded by different stressors. And so there is going to be, inflammatory responses, which would lead to, potentially things like high cholesterol. And so taking a really good curcumin supplement is really going to help to minimize that inflammation, to allow your body to, again, not build that heart disease. Red yeast rice. This is kind of a cool kind of a cool thing, especially when it's paired with CoQ10. It provides a really synergistic formulation designed to reduce cholesterol synthesis. It really supports healthy inflammatory responses and promotes healthy blood sugar levels. Remember, elevated blood sugar levels are going to create higher levels of insulin, which again, inflammatory responses, which is one of the number one causes of like arteriosclerosis, so hardening of the arteries and coronary heart disease. There was a really cool study that they did that when consuming red yeast rice, it actually lowered total cholesterol levels by about 15%, and it actually lowered LDL cholesterol levels by 21%. So that is, guys, sometimes we just think that because medications took millions or billions of dollars to create, and they go through some pretty significant strenuous testing protocols, and they're approved by the FDA, and they're marketed with billions of dollars, and they're prescribed by medical doctors, we think that they've got to be really good and powerful, and that there isn't anything that would compare to that. But when you look at this study, when they showed how much just consuming red yeast rice and CoQ10, how it can lower total cholesterol levels by 15% and lower LDL levels by 21%. Understand, there's not a drug out there ever proven to influence cholesterol that much. It doesn't exist. Well, why don't they promote this? Well, ultimately, there's not as much money as there is behind a patent medication. That's one of the reasons. There's no profit in health. There's profit in disease, and there's profit in selling millions and billions of dollars worth of medication. So these are some of the best nutrients when it comes to supporting healthy cholesterol. Ultimately, in Max Living, we've created some really specific supplements. And one of the reasons why I like these the best, the plant sterols, the structure actually have so specifically the plant sterols, they have a similar structure to cholesterol, which can hinder the absorption, which I talked about. And one of the reasons why I like this the best is because you get these from dark green leafies. Like if you ate a ton of vegetables, a ton of dark green leafies, you would get a lot of these plant sterols. Now, it's really hard to consume a therapeutic dosage of that. It's kind of impossible to eat that much salad. But when you can really condense this down into a nutraceutical, like a therapeutic dosage, it makes a big difference in your inflammatory and your cholesterol responses. One of the reasons why I like this the best is because it's from an organic source, so it's not ridden with pesticides and other toxins that would actually cause damage and increase inflammation from the toxicity stuff. So one of the reasons why I like Max Livings is because it comes from a really, really clean source. The curcumin plus is a power anti-inflammatory and antioxidant formulation designed for optimal bioavailability. One of the reasons why I like ours the most, this Max Living supplement the most, is because a study was done that basically showed that it was 10 times more bioavailable, meaning that you're 10 times more likely to absorb it because of the maximum efficiency enhanced by the absorption by combining quercetin and resveratrol to increase the permeability. So the formulation specifically is to increase the bioavailability in your absorption. So again, it's going to be significantly more potent and therapeutic because of that absorption. One of the cool things I like about the red yeast is because they've combined it with that CoQ10. Everybody recognizes how important CoQ10 is when it comes to heart health, especially if you have high cholesterol. And so again, that study that they shown was the combination of these two. So the study that reduced total LDLs or total cholesterol was the combination of the red yeast rice and the CoQ10. So again, that's another reason why I'm really liking how Maximize Living formulated that. So that is the bundle that I really recommend if you have cholesterol issues, if you have higher levels of cholesterol. Now we talked about statins, and our statins the answer. I want to talk real quick about what statins actually do. But if you look over here on the side, you can see cholesterol and really what it does. Cholesterol is made by the body. It's an intelligent response. Cholesterol is actually the base building blocks of hormones. So your body's ability to stress is based off of those hormones. And it is also the building blocks of like sex hormones, like testosterone. So if you're taking a statin medication, one of the number one side effects is low testosterone because it's blocking like the formulation, the creation of cholesterol. And so if you have low testosterone, you have bad cholesterol. You need to make sure that we're fixing that underlying causing, not just taking statin medication, because it'll lower that. Every single cell in your entire body has a lipid bilayer, so it's created from cholesterol. So cholesterol is significantly important for every single cell function. It also, we talked about how cholesterol is actually the healing mechanism. Cholesterol is critical. Most of your brain is made up of cholesterol. About 60% of your brain is cholesterol. So again, it's really important to have good cholesterol. And obviously it's important for bile salts and the breakdown of food. So here's kind of an interesting stat. One of the studies they did, and this is how you can change numbers, because you think, like, you hear like, oh man, cholesterol like lowers your chance of heart attack by 50%. Well, technically they looked at like 100 people, 2 of them have heart attacks. Like, that's the rate. 2 out of 10 people having heart attacks. If you take a statin, it becomes 1 out of 100. So it's a relative rate going from 1 out of 100, or from 2 out of 100 to 1 out of 100. And so it looks like it's a 50% improvement, but technically the real change is only 1%. In fact, real studies have shown that you're more likely to have a heart attack on a statin with like good numbers than if you are not and you have high cholesterol. In fact, if you have a heart attack, having higher levels of cholesterol are shown to actually help save your life because of the inflammatory and the healing response. So statins block the enzymes that actually create cholesterol. So it's tricking your body into not creating cholesterol. Here's some of the main symptoms and side effects for a statin drug. And this is one thing that I don't think we talk about enough, is side effects of medication. And I understand, like, when you're watching a commercial, most of the commercial is about the side effects, but they do it in a way that people can watch all the terrible side effects and at the end of the commercial still think that that would be a good idea. But look at side effects of statin medications. Parkinson's, dementia, because it robs the cholesterol from your brain, so it causes accelerated brain atrophy, and so it increases depression, because again, it messes with cholesterol in the brain. It lowers CoQ10, which is the antioxidant in your heart. It obviously, adverse effects are damages muscles, nerve damage, liver damage, endocrine damage. One of the number one side effects for cancer, or for statin drugs, is cancer, as well as damage to the heart because of the decrease in CoQ10 and the antioxidant in the heart muscle. So just understand that there are real dangers to taking medications. And I'm not saying that there's never a time and place, but we should never be on these drugs for a long period of time. We should look at the underlying cause, how to correct that so we can get our body healthy, a normal, healthy cholesterol levels, so that we don't need a medication. That's the whole point, is get so gosh dang healthy that we don't need a drug. Now, if you've ever been on a statin, here's 2 supplements I'm going to recommend that you have to get on. CoQ10, in fact, the Dr. Wolfson, which is the paleocardiologist, real famous, he is renowned for saying that it is like malpractice. Like, your medical doctor should have like a malpractice lawsuit if he gives you a statin and he doesn't put you on CoQ10. Like, that's how critically important it is for you to take CoQ10, because again, the antioxidant, which is most found in the heart muscle, is CoQ10. So by taking a statin drug, it depletes that. So you're putting your heart muscles at significant more risk of injury. And so you have to take CoQ10. And then obviously you want to combine that with D3 because of the damaging effects of statin medication. So those are the 2 medications or supplements that I'm going to really highly recommend if you've ever had to take a statin medication. So arrhythmias, the other part which can lead to things like heart attack, AFib, VFib, tachycardia, bradycardia. So again, your heart just isn't beating appropriately. One of the number one causes of this inability for contraction or rhythm is an imbalance in electrolytes, specific things like potassium and magnesium. And so if you have AFib, 2 things. You have to look at the neurological innervation to your heart. You have to look to see if there's any subluxations, because the brain nerve system is what sends the electrical impulse to the heart to contract. So if there's interference, you could get dysfunction, arrhythmias. Number 2 is you could have an electrolyte imbalance, which is the synapse. It controls the synapse in that nerve system. And so if you have a deficiency, it could be leading to more and more dysfunction. So if you have things like arrhythmias, I would really focus on taking a really, really good magnesium supplement to make sure that you're having proper neurocommunication. Anginas, so muscle cramping due to not enough oxygen into the heart. One of the things that they found when someone has angina is they have a decrease in vitamin B, like vitamin Bs, as well as vitamin E. When you have high levels of inflammation, it actually blocks your absorption of some of these. So again, sometimes the solution is not to just take more supplements because there could be a deficiency. Sometimes you have to look at the absorption. Like your body's not absorbing it, not because you're not consuming enough really good nutrients or supplements, but because there's these underlying causes of damage, and you got to remove the underlying causes of damage. However, if you're not taking these and you have that stuff, that might be a really good recommendation to help with, again, creating a little bit better oxygen flow into the heart muscle. High blood pressure, also known as the silent killer. This is one of those things that like people just, I don't know why they don't understand that the body is intelligent response. My father-in-law would get crazy high blood pressure, like skyrocket, and he would like be almost stroking out. And so his cardiologist put him on all these different medications. Well, at the same time, he was having all these other health issues, and one of the problems is his kidneys were shutting down. And so the kidneys, the blood flow was shunted to the kidneys, and so the kidneys weren't getting very good blood flow. So the kidneys were releasing a hormone to try to increase the blood pressure, to try to force more blood to the kidney. The kidneys were releasing a hormone to try to get more blood to the kidney because the kidney was dying. But the blood pressure would cause him to have these terrible migraines and all this sort of stuff. So he'd go to his cardiologist and they'd put him on blood pressure meds to lower his blood pressure. But then his kidney wasn't getting any blood, so the kidney was dying. And so the nephrologist was working with the kidneys, and they were going back and forth and back and forth. Well, the nephrologist basically told my father-in-law that the main reason his kidney shut down is because he was taking a baby aspirin a day for about 20 years. Because his cardiologist and heart recommendations tend to be like take a baby aspirin a day for heart health, but it's not a supplement. He had high levels of blood pressure because he had all these different stressors and underlying health issues, and he had a terrible nutrition plan. He didn't, he had all these exposures to toxins that were causing inflammatory responses, which was what was causing the high blood pressure. But the doctor gave him this recommendation to take these medications, which shut down his kidney, which again forced his blood pressure up. And so instead of looking at the underlying cause of why the blood pressure was high and really helping to get the kidney healthy, which would lower the blood pressure over time, they just kept going back and forth with these drugs, which eventually just killed his kidney, and he had to have his kidney removed. And now he has like 4% function in his last kidney. So understanding the underlying cause. Now, one of the things that can really help if you have high blood pressure is things like nitric oxide, because it helps with like dilation of blood vessels. So nitric oxide is a molecule that your body produces. So it naturally produces it to relax blood vessels and to increase circulation. It is crucial for a variety of functions, including the relaxation of blood vessels for healthy cardiovascular function. So instead of, taking a drug, if we can do something maybe a little bit more natural and do something like a NOx support or the blood pressure support, or specifically, this is the bundle that I recommend. If you have high blood pressure, it's going to help with decreasing the stress in those arteries, which is why the blood pressure is so high, to force that blood pressure through. If you can relax those arteries a bit better, it'll just be an easier flow, so the body's not going to have to push it so hard. So if my father-in-law could have done something like this instead of a baby aspirin a day, we wouldn't be dealing with his kidneys dying. So this is the nutritional bundle that I really recommend if you've ever dealt with high blood pressure. So now, like, talking about real solutions, and again, going back to the 5 essentials. So core chiropractic, nutrition, mindset, exercise, minimizing toxins, every single health category under the sun falls under one of these 5 essentials. If we could just really learn how to implement each one of these different essentials, the outcome is going to be better health. Now, understand, it's not like a menu. You can't just pick and choose which essentials you feel look good or feel sexy. You got to understand, if you're not applying each one of these essentials, that there's going to be a pretty big blind spot that could really sabotage your overall health. If you're doing great with your adjustments, if you're doing great with your exercise, but you're eating bad, or your life is bombarded with toxicity, again, you're still likely to build disease and become a victim of like this heart disease, cancers, or whatever. So to really ultimately give yourself the best chance, or to give your kids the best chance to having long-term health and vitality and not needing a drug, we got to make sure we're looking at each and every single one of these 5 essentials. So heart health, nutrition, ultimately, this is, and there's lots of good nutrition plans out there. Paleo, clean keto, the Mediterranean diet. There's all sorts of different good nutrition plans out there, but ultimately, here's the fundamental thing. The fundamental purpose, fundamental idea of this is eat real food, okay? Eat real food. The more processed, the more touched by man, the worse it's going to be. Ultimately, the more inflammation it's going to be. But here's kind of like some main broad things. You want to minimize bad oils. You want to minimize damaged oils. You want to increase healthy oils, healthy fats. You want to minimize sugars. You want to minimize processed carbs. You want to minimize artificial ingredients. I would really highly recommend doing the advanced or the core nutrition plan. They're relatively similar to like a healthy keto, but not as strict. But again, you want healthy levels of fat. You want to minimize your total carb consumption because inflammatory responses, especially things like gluten and even potentially things like dairy, depending on what you have going on. But that's like the broad basis. Broad basis is you just want to eat more real food, less man-made food, less processed food. Avoid the bad oils like canola oil, vegetable oil, trans fats. You want to increase healthy whole foods, whole vegetables. You want to do organic meats. So you don't want to have like processed meat that has been fed a bunch of GMO grain or lots of pesticide-ridden hay or grass, because that's going to cause the meat to get sick or inflamed. And obviously, same thing with you. You'll get inflamed if you eat unhealthy meat. You want to really avoid like farm-raised fish, stuff like that. So there's lots of good nutrition plans out there. I'm going to highly recommend looking into the core or the advanced max living nutrition protocols, because it's really about clean. Because you can do like keto, but you can do bad keto, and yeah, you might lose weight, but you're not reducing inflammatory responses, and you're going to build disease. So really, the advanced plan is a anti-inflammatory nutrition strategy. It is a healing diet. Okay, so we'll kind of look into doing that, and we'll answer some questions, or we'll provide some additional resources. We have other webinars that really go into detail specifically about the nutrition protocols. But when you look at it back in the 1960s, 70s, when heart disease exploded on the scene, is because they made fat out to be the bad guy. And that's when they started to introduce this low fat and no fat like solutions for food. And when they took the fat out, guess what they put in? Yeah, they put in sugar. And that's what ultimately caused all these high levels of inflammation, which is what led to all this inflammatory cholesterol, heart disease, even cancers. So increasing heart healthy fats is critical for creating a healthy cardiovascular system, because it's going to help lower inflammation, not raise it, but actually healthy fats lower inflammation so that you're not building bad levels of cholesterol. That's ultimately why things like omega supplements are such a huge deal when it comes to heart health. I'm sure you've probably seen it all over TV or just in social media or other health content, is how important like omega supplements are. Specific things like omega-3 as an anti-inflammatory. In fact, when they look at actual scientific studies, when you consume things like healthy fish, so good healthy fats, it can lower and reduce coronary heart disease by 36%. 36%. Again, looking at like blood pressure, blood pressure medications, statin medications, there's never a study ever been done that can lower your chance of heart disease by 36%. So just consuming really good amounts of healthy fat or supplementing with a really good omega supplement, you're going to really lower that inflammatory responses, which again is going to minimize even up to 36% your risk of heart disease. And one of the reasons why I like the Max Living brand so much is because it comes from really clean sources. And it is the optimal balance between your 3, 6s, and 9. So it actually balances out all your omegas to get the optimal result as far as anti-inflammatory responses. Plus, it's really important for stuff like hormones, your endocrine system. You have to get good healthy fats for hormones and endocrine system function. But it's also imperative for cognitive function. You got to make sure you're getting a good amount of healthy fat for brain health, and taking a really good optimal or omega supplement is critical. So I really highly recommend the Max Living Optimal Omega, because it has the correct ratio, 3, 6s, and 9s, as well as we know it's coming from clean sources. So again, it's not coming from like farm-raised fish, which are fed terrible diets and they're super sick. I mean, farm-raised fish are just really bad for you, so you don't want sources from stuff like that. Now, getting some sources from plants are really good. And again, part of that optimal omega has not just like animal fats from like fish, but it has some plant fats in there too. So it has this beautiful synergistic combination of all the different really good sources. Exercise, and this is no surprise to anybody that good exercise is going to help cardiovascular health. But again, when we look at studies done with exercise versus studies done with medication, it boggles my mind that more people turn to drugs than exercise. Like, why in the world would a medical doctor tell you to take a drug that could potentially decrease your risk of heart disease by 1%, when if we just exercise regularly, it could reduce your risk factors by over 50%? Well, the reason is because, I don't know, people want that easy button. People want that easy pill. I don't know why we've been brainwashed into thinking like that's a good solution, but it's not. Ultimately, research has been proven time and time again to be better than a drug in all sorts of different situations. Exercise is better for depression than any antidepressant out there by like 10 or 15 fold, because of how the body responds hormonally to movement. It oxygenates the system, it circulates blood flow. Exercise is critical. I mean, if we're not moving, if we have a sedentary lifestyle, we're ultimately suffocating our cells to death, because the only way cells get oxygen, which cells have to have oxygen to survive and to function, that's its main fuel source. If you're not moving, you're literally suffocating your cells, and your body is creating all this damage and inflammatory responses. So just a little bit of exercise can reduce your risk factors by almost 60%. Now, what do we mean by exercise? Well, walking is good, and I'm not trying to dog the fact that you go out and walk, but ultimately, when they look at these studies, you got to increase your heart rate. You got to get to a point where your body is breathing hard. So one of the things that I recommend is max T3. Some of these studies really look at like you have to do like 30 minutes a day, 5 days a week. And that's a lot of exercise, and that's really good if you can do that. But ultimately, some of the main reasons why people don't exercise is they don't have that kind of time, or they don't know what to do, or gyms can be expensive, or a personal trainer can be expensive, especially if you don't have a background in exercise and you go to the gym and you look and you have no idea what to do. And so you get bored, or like you're not getting results because you're just not doing it effectively. This is what I recommend. It's max T3. One of the best things about max T3 is that it's a short duration, high intensity. So you get the best benefits out of exercise, but ultimately it's a 12-minute exercise program. 12 minutes. And I know every single one of you has at least 12 minutes that you can spare, so that you can prevent up to 60% of heart disease. This is something that I want you to start teaching your kids. We have like a little gym set up in our garage. And when we go out there and we start to exercise, Kensley will want to come out there. Now, she doesn't like lift weights, but what we do is we set up like a little obstacle course. And so she's running and jumping and doing somersaults, or she'll do some sit-ups or some push-ups, or she'll climb, or she'll do some jumping jacks, but she's moving with us. We're teaching her how important exercise is for her to feel good and to be healthy. So at maxt3.com, one of the best parts is it's like $19. It's a one-time payment. You get access to all the information online. You can watch it on your computer. You can stream it to your TV. It really requires really not a lot of equipment or anything. So you can basically do this in your living room, and you can do it with your entire family. Now, if you have like a bad hip or a bad knee, or you feel like you've never exercised before, so you're significantly out of shape and you're worried about even being able to do this sort of exercise, one of my favorite things about max T3 is they divide it up into modifications. So if you're really elite, you would follow this workout movement. If you're not very fit, you can do this movement, which it's just a modified version. So instead of doing like a push-up, you're doing a push-up against a wall, which anybody can do. Or instead of doing a jumping squat, you're just doing a real light, medium squat. And as your body build up strength and as you build up some endurance, well, then you can obviously graduate up into higher levels of that movement. So it's as easy as anyone can do it. So if you're sitting there thinking like, oh my gosh, like there's no way I could do that. You could absolutely do that. No matter what situation you're in, there's a modification for you to be able to do this exercise. Now, I don't care how elite you are. If you're a CrossFitter and you've been doing CrossFit for years, I promise you, if you do one of these max T3 programs, it is going to be a burner, and you're going to get an awesome exercise, an awesome workout. So maxt3.com. Obviously, our mindset is one of the 5 essentials we call max mind. It's mindset, because we have to understand that stress increases dysfunction and disease. So high levels of stress increase blood pressure, increase heart disease, it increases inflammation. So when we talk about mindset, some of the most important things that I would recommend is planning out your schedule. So So not just winging it, because that's when stress happens. You're like, oh my gosh, I got this and this and this, and things just pile up. The more you can plan out your week, the more you can plan out your day, the more effective and efficient you'll be. But also you can plan out rest time. You can plan out exercise time. You can plan out decompression time. You can plan out time with family. When you're not planning, so here's the saying, if you fail to plan, your plan will fail. So ultimately every Sunday, my wife and I will sit down and we'll kind of go through our week and where we need to make sure we're getting things accomplished, like this appointment, this and this. Kenzie has this going on. This is when we want to put our date time in. This is when we want to make sure we have hangout time or whatever, or relax time. And then we kind of review that on a daily basis as well. So we're consistently trying to work our schedule to where we have plans to be able to make sure that we're getting everything done and effective and efficient and running businesses and working with patients and leading teams and leading patients and obviously having a great family life. So you got to make sure that you're planning out your week. That's critically important. We talked about toxicity and understanding where to minimize toxins. I'm going to highly recommend that you get plugged back into our toxicity webinar to really learn where these major sources of toxins are coming from, but ultimately how you can start to avoid it. Switch stuff out. So use this product, not that product, because this product is toxic. Coming up on summer, we look at sunscreen. When you actually look at the increase in skin cancer, it actually skyrocketed when they started to introduce sunscreen, which is really counterintuitive because doesn't sunscreen help prevent skin cancer? Well, what they find is that a lot of the chemicals in the sunscreen are carcinogenic. They're cancer causing toxins. And so by applying all that stuff on your skin, your body's absorbing that and it's causing damage and it's actually building cancer. Now, I'm not saying don't use sunscreen. I mean, I don't really like to use a lot of sunscreen because I don't want to block vitamin D absorption, but you also got to be smart. You can't just go out in the sun for 8 hours in the middle of summer if you look like me, super white, red hair, because you'll get pretty seriously damaged. But you don't want to block the sun totally. You want to make sure you're maybe wearing some protective clothing, or if you are going to use sunscreen, really make sure you're using like a healthy organic version that doesn't have all those chemical causing compounds. Okay. So core chiropractic is obviously the first essential because you have to make sure that you're protecting and keeping balance your nerve system. You could do everything else right, good nutrition, exercise every day, look incredibly fit. You can minimize all the toxins, but like my dad, if you had damage to your spine, that's putting pressure to the nerve system going to the heart. So you have this interference in function and dysfunction over years. Your body's going to create disease. I mean, that's if the nerve system is imbalanced, all the research points to your body will build dysfunction and disease. So consistently making sure your spine and nerve system is healthy so your nerve system is regulated. That is why my family gets adjusted. That's why my little girl gets adjusted. So many people might come into the office initially and they see all these kids running around and all these kids getting adjusted and you're like, what the heck? Why are all these kids coming in here? Like they found all the kids that have back pain? No, it's because the parents, we want to make sure that our kids' spine and nerve system is balanced. We got to make sure that the nerve system is healthy, so that way they have healthy adaptations, healthy responses to stress, that their nerve system is able to overcome inflammatory responses and stuff like that. That's why I adjust my family. That's why every single week I get adjusted. My wife gets adjusted. Every single, not necessarily every week, but several times a month, every other week, once a month for sure, sometimes once a week, my little girl will get checked. All of our team in the office gets adjusted every single week because we want to make sure that our nerve system is optimally balanced so that we can overcome these life stressors. So here are your action steps moving forward. I want you to start looking into following a really good nutrition protocol. So avoiding the damaging foods that cause inflammation that will lead to high levels of cholesterol, high levels of blood pressure, and ultimately cardiovascular disease, coronary artery disease, and heart attacks. Okay, so look at the max living nutrition plans. Maybe you can check out doing the advanced plan for 30 days, 60 days, and then really start settling into the core plan. The core plan is ultimately just a healthy approach to whole food nutrition. That's like a whole family nutrition strategy. The advanced plan, like I said, is more of an anti-inflammatory or a healing diet. It's not really designed to do forever because it is relatively strict. But if you have disease or if you have signs of disease or symptoms of disease, understand that you have to do something relatively aggressive to heal. In fact, this is something that like I hope you took away from this is if you don't want to end up with the statistics of heart disease and cancers and all this stuff like the general population is you have to do something radically different, which means you can't just live the standard American lifestyle. You can't live the standard American diet. So again, I want you to look into the core plan and the Max Living advanced nutrition strategies so that we can start to shift that, obviously that healthy nutrition to reduce the disease process. Start doing some Max T3, maxt3.com. It's $19 and you can start doing it a couple times a week. Like I said, it only takes 12 minutes. It's not going to be like 30 minutes. You don't have to go to the gym. It's not $20 a month. It's literally a one-time payment of like $19. Then you have access to all these different workouts online that will literally get you some of the most amazing results possible. Other recommendations, if you have high cholesterol, I want you to get on this specific cholesterol balancing bundle. The red yeast, rice, CoQ10, the curcumin, and the plant sterols, that is going to help reduce the inflammatory responses to help your body self-regulate and help really lower bad cholesterol, okay? If you've had cholesterol, I really want you to start getting on the CoQ10 and the D3. Make sure you're taking a healthy magnesium. And one of the things, though, like understanding how important magnesium, Max Living has an essential nutrition, but it's not a bundle, but it's basically the 5 non-negotiable supplements that we recommend religiously. Doesn't matter where you're at in your health, if you have disease, if you don't have disease, the 5 most important supplements that you have to be taking to be responsible with your health is a multivitamin. So Max Living has a really good multivitamin, vitamin D3, an omega, magnesium, and the B complex. Those are the 5 non-negotiables. So that's why magnesium is so critical, because it's responsible for so many metabolic functions, brain function, cardiovascular function. If you're not taking magnesium, and again, one of the reasons I would really recommend Max Living one is because of the formulation. That means that the form of magnesium that it is for optimal absorption and utilization of the body. If you have blood pressure issues, I'm really going to recommend that NOx support, which again, the nitric oxide, which the body does create. So this is basically building blocks for your body to create more of that to help relax those blood vessels to allow the blood to flow. So it's not the heart's not having to work so hard. And then obviously in synergistic with the blood pressure support. Blood vessel bundles, if you have atherosclerosis, if you have hardening the arteries, if you have any kind of blood vessel issues, I would really highly recommend this specific bundle. Okay, the Max NATO, the NOx support, and the garlic parsley oil blend. Again, really good anti-inflammatory. Cardiovascular bundle. If you don't have any of that stuff, you're just really wanting to make sure, like maybe you have it in your family, but you've never been diagnosed, nor do you have symptoms. Here's kind of a baseline, just cardiovascular wellness bundle. I do think that people really should take CoQ10, and I take curcumin as just a really good anti-inflammatory, just in general. I don't have inflammatory issues, but I just want to make sure that I'm not building inflammatory issues because of just normal stressors of life. Upcoming events. If you've never had if you know someone who has health issues, I would highly recommend that you try to get them in as soon as possible to the office. In fact, here coming up is our Friends and Family Week. And during this week, we reduce the fee for an initial evaluation, exam, and x-ray. So when someone comes in the office, the first thing we're going to look at is your nerve system. So we do a full neurological exam, right? So doctor consultation, full neurological exam. We do thermal imaging to look for areas of inflammation, stress, damage to the nerve system. We do orthopedic tests, neurological exams. We do postural scans, bilateral weight scale testing, and we do full spine digital x-rays. Now, if you were to go to a medical doctor and to get all of that done, consultation with the neurologist, report of findings, that could cost thousands and thousands of dollars. Normally in our office, it costs around $290, but when we do special like Friends and Family Weeks, we reduce this to a $29 entrance exam fee. That covers your entire exam, thermal imaging to find if there's stress in your nerve system, full spine digital x-rays to find out if there's misalignments or damage in your spine affecting your nerve system. So that way we can really understand a really good treatment protocol to start correcting your spine, to help with joints, to help with discs, to help with your nerve system. So your body has that balanced nerve system we talked about. So all that is covered by $29 during our Friends and Family Week. Okay, so make sure you're getting in contact with the office so that way we can help your friends, your family members, the ones that you really care, the ones that you love, to make sure they're not leading to, again, more things like heart disease, cancers, these terrible statistics that we see going on. Get connected. Follow us on our social media pages. We have tons of stuff on YouTube and on our Facebook. So make sure you're getting plugged into all that stuff. All right, guys, that's what I got for you. Make sure if you have any questions in the office, make sure you're asking or communicating through our social media and our closed Facebook groups or whatever. Make sure you're taking those action steps, starting the nutrition plan, starting the Max T3 workouts, getting on those supplement bundles. All right, guys, we will talk to you later. Hope you guys enjoyed that. Let us know if you have any other questions.